Welcome back to Living with MS 24/7, 365. I'm so glad you decided to join us. Today, we're kicking off a series dedicated to a crucial topic for those living with multiple sclerosis. We'll explore the various symptoms of MS and share effective strategies for managing them. MS is a condition that manifests in a wide array of symptoms. Each person's experience with MS is unique, with no two patients sharing the exact same journey. To kick things off, let's start with what is often the first and most common symptom experienced by MS patients: vision issues. Vision problems are frequently the initial indication of multiple sclerosis and can vary wildly from person to person. In this video, we'll delve into the various vision-related challenges that come with MS, such as optic neuritis, double vision, and nystagmus. We'll discuss what causes these symptoms, how they manifest, and what steps you can take to manage them effectively. By understanding these symptoms and learning about the available treatments and coping strategies, you can better navigate your journey with MS. Let's explore the vision issues associated with MS and discuss the best ways to manage and mitigate their impact on daily life. First up, let's talk about optic neuritis. Optic neuritis in MS happens when the immune system mistakenly attacks the protective covering of the optic nerve or myelin sheath, causing inflammation. This inflammation can lead to symptoms like pain, blurry vision, and temporary vision loss. It's kind of like the optic nerve gets a bit shorted out, making it harder for visual information to travel from your eyes to your brain smoothly. Next, we have double vision, also known as diplopia. Diplopia occurs when you perceive two images as a single object. The images can appear side by side or on top of each other, making it difficult to focus on the object in question. This can be quite disorienting and can significantly impact daily activities. Diplopia can arise when the muscles controlling eye movement are weakened or uncoordinated, causing the eyes to point in slightly different directions. This misalignment can confuse the brain, which then interprets the visual input as two separate images. It's a bit like when a camera lens goes out of focus, except it's happening with your own vision. The impact of double vision extends beyond just seeing double. It can also lead to balance issues, as your brain struggles to reconcile the conflicting visual information. This can make it harder to walk straight, navigate through spaces, or even perform simple tasks without feeling unsteady. Imagine trying to step off a curb when you see two curbs instead of one. It can be quite challenging and even risky. Now, nystagmus is another common issue in MS. It is a condition where the eyes make involuntary movement. These movements can be in different directions, either side to side or up and down, or even in a circular pattern. Think about like the eyes are shaking or vibrating without your control. Like normally your eye movements are smooth and coordinated, allowing you to focus on objects easily. However, with nystagmus, the eyes move unpredictably and constantly. This can make it difficult to focus on objects, leading to a sensation that your surroundings are moving or jittery. Because of these involuntary eye movements, people with nystagmus can experience dizziness and nausea. The brain receives mixed signals from the eyes, making it hard to process visual information correctly. It kind of feels like if you were trying to read a book while someone's shaking it in front of you. Additionally, nystagmus can lead to balance problems. Your body relies on stable visual input to maintain balance. When your vision is constantly moving, it disrupts this stability, making it harder to walk straight or maintain your posture. Some other vision problems associated with MS can include blurry vision, a reduced ability to see differences in light or color, partially or complete loss of vision, difficulty tracking, or oscillopsia, which is a feeling of an unstable visual world. So, what treatments and tips can help with MS vision problems? Here are a few recommendations. For optic neuritis, there's anti-inflammatory medications that can help. For example, steroids might be prescribed to reduce inflammation and improve vision. Nystagmus, sometimes they will prescribe anti-seizure medications or a muscle relaxant, and they can be effective. Those would be medications like gabapentin or baclofen. For double vision or diplopia, a short course of corticosteroids or eyeglasses with special prisms can help align your vision. The glasses with prisms can help to make a single image show up instead of two. For improving comfort and productivity at home and work, you can organize your possessions and things so that they're easier to find. For example, keeping frequently used items in specific, easy-to-reach places. You can increase lighting in important work areas like around your desk or in the kitchen. You can experiment with different types of lighting to see what works best for you. You can eliminate glare by repositioning your mirrors and shiny objects. You can use paint or colored tape to mark light switches, doorways, and steps to heighten contrast. Sometimes opting for large print materials for books, clocks, and computer displays. Adjust your font sizes on your devices for easier reading. Be practical. Carry a flashlight when going to dimly lit places like movie theaters, and learn the layout of new environments in advance. Diplopia and nystagmus can affect your navigation and balance. These, together with the mobility challenges associated with MS already, are a safety risk. An occupational rehabilitation therapist can help you adjust to your level of visual impairment. Remember, it's important to ask for help when you need it. These adjustments can make a big difference in your daily life. Thanks for tuning in. I hope you found this video helpful and informative. If you did, please hit that like button, share this video with others, and subscribe to my channel, Living with MS 24/7, 365, for more content on living with multiple sclerosis. Stay tuned for next week's video, where we'll be kicking off another series exploring various MS patient resources available. Until next time, take care, and remember, life doesn't stop just because you have to. Thanks.